when I was a little kid. My dad used to make the display windows for Macy's in New York. This was the old time where you had all these gears and mechanism motions. And that got me interested in human motion and how to replicate that. I went to MIT to be a mechanical engineer and really got interested in human motion there. And that took me to med school, and that took me to orthopedics. When I started in joint replacement, it was a very sophisticated, already well-developed path. Everyone told me there was really nothing left to develop. It was the norm to make a great big incision because that's what you, quote, needed to do. I thought maybe there was a less invasive way, that the patients would recover a little bit faster. I started working with one of the implant companies on developing my own instruments. I went down to the cadaver lab every night for 2 years and worked on how to develop a minimally invasive approach to doing hip replacements first, knee replacements second. And my thought was it would let patients get better a little bit faster. Science is interesting because it's a community. And if you're kind of against that or doing something different, you end up paying the price for it. I had everyone from physical therapy to anesthesia to people on the national and international stage telling me I was crazy. I'm an introvert and didn't care what anyone else thought and was pretty disagreeable about it and said, this is what I'm going to do. It's going to help patients. Fortunately, Rush supported me. At the time, the length of stay was about 4 or 5 days in the hospital. We got it down to a couple of hours by changing the surgery. Then we changed everything around the surgery. We had to change the therapy. We had to change the medications. We had to change the anesthesia. And that's what led to not just minimally invasive surgery, but outpatient minimally invasive surgery. The leadership is unbelievably important. Rush is a good example of that. For someone like me to take a crazy path, without that support, without that encouragement, I would not have been able to do this, and my patients and the rest of the world wouldn't be able to benefit. That's why leadership is really, really important. Through innovations, Rush has become a place to come to for orthopedics, not just throughout the Chicagoland, not throughout Illinois or the country. I have people coming from literally all over the world to seek this specialized care that can really, up until recently, only been done here at Rush.